Hi there, this is Casey with the Injection and Infusion Clinic of ABQ. So, you've probably heard, if you're on this webpage, you've probably heard about these weight loss injections that are pretty much sweeping the nation, and it's very exciting for weight loss. And so, these injections are called GLP-1s, and there's also an injection called GIPs that's combined. So, the GLP-1 is the semaglutide, and the GLP-1 with GIP is tirzepatide, is the generic names for them. So, how do these injections work? So, if you're here on this page listening to this video, you're probably wondering, will this work for me? Should I do this? I don't understand. It's expensive, so I want to make sure it's going to work. All completely valid concerns, of course. So, let's dive in. So, the way these injections work to start with is gastric emptying. It slows down gastric emptying. So then that leads to a decreased appetite and increased satiety. So you don't feel hungry. And that's a wonderful effect. This can be really helpful. And this is where the early, fast kind of weight loss, exciting. This is the exciting piece of this diagram, right? It happens kind of right away. And most of our patients do experience some weight loss right away. Not all of them, but I would say most of them. And so this is great. But obviously, we don't want to go too far with this, right? We want the body to adjust. We don't want gastric emptying to be gastric no emptying at all. It has to move. And so there is a balance. And this is why we increase the dose slowly. Well, increasing that dose slowly makes weight loss happen slower, but it is important to be careful so that we don't have all those side effects that you're probably hearing about in some of the more sensationalistic news stories. So how else do they work? And from a medical perspective, from my perspective, I'm a nurse practitioner, is that they work in these other ways, and that's really exciting. This is great, but the other ways are really exciting to us from a medical perspective. So one of the things that they do, and this is more for the diabetic population, but they increase insulin secretion, and so that helps lower glucose levels. Well, the thing about these that makes it better and different from like metformin is that it only pushes insulin secretion from the pancreas when glucose levels are high, whereas metformin pushes the pancreas regardless of glucose levels. So the risk of hypoglycemia, although it's not high with metformin, it does exist. And with these injections, you will see it as a risk, but it's probably more related to the other medications that somebody may be on. And because it is specific to high glucose levels where it pushes that. The other thing it does is it helps beta cells, which are the cells that produce insulin, it helps them to survive and proliferate to make more of them, right? And so those are great. This is more for the diabetic kind of aspect of these GLP-1s. But for the weight loss group, one of the reasons that people have stubborn weight loss, and some people have, I feel so bad for them. They have very stubborn weight loss no matter what they do. They could probably starve, stop eating, and still not lose weight. They might dehydrate, but they won't lose weight. But one of the areas that it really, really, really works, and one of the areas that we don't have a ton of long-term data, but I really do believe, just kind of understanding how things work, is that when insulin resistance is improved, the weight loss becomes easier and will stay off. And so I do suspect that long term, people are going to be able to wean themselves off these shots and find that they're able to maintain their weight. They might see some weight creeping back on, but it's not going to be the yo-yo dieting that you may or may not have experienced in the past. So the insulin resistance part is from this glucose uptake. So what happens is that these cells, and I'm showing a muscle cell here, but these cells have glucose in them, right? And so the insulin and the glucose that is in our bloodstream, that's not in a cell, they're floating around. They're saying, hey, can we come in? And the cells are saying, no, we're full. We have plenty of glucose. And so they shut their doors. And so then all this glucose and insulin has nowhere to go. And it says, okay, well, let's go store some glucose because we might need it later. So let's go make some fat. And so that is major part of the problem, right? And so what these injections do is they improve that glucose uptake. They say they're a little more persistent with the cells, say, hey, no, come on, go ahead and let us in, please. We're not bad. And so it helps improve that insulin resistance. And that's a very simplified explanation, but it's probably the best way to explain it. So, but the reason I'm talking about this is I want people to understand that this aspect of these injections can take a long time to start seeing some improvements. And some of our patients do choose to get some baseline labs, and we do recommend these. But if they do choose them, we often will see a high insulin level floating around in their bloodstream. It doesn't mean that they're getting great glucose uptake. It just means there's a lot of insulin floating around. And so this is a symptom, a sign, if you will, of insulin resistance. So that we don't always see insulin resistance on a piece of lab paper, but we often do. And so when we do see this, I like to see repeat labs later where it kind of shows an improvement. But the true proof in the pudding, right, is that actual weight loss occurs. And so that's how that works. And this can take, when I say a long time, like I hesitate to throw these numbers out there, but it could be like 9 to 12 months. You'll probably see some improvements sooner, but like to see true improvements in insulin resistance, like it's going to take a while. And so if somebody comes to us and they have a long history of very stubborn weight loss and it's very suspicious for insulin resistance, I find that they have a much harder time losing weight on these injections. So it takes longer. But I will say that the patients that have stuck with it and slowly increased their dose and just worked with us and stayed patient and kept working with it, they do eventually see the weight coming off. It just takes a while. And I completely understand that it's very frustrating, especially since these injections are not super cheap. And so it can be, it takes a lot of faith to keep stepping forward with them. But another area that these injections work is fat lipolysis. So it actually breaks down fat cells, which who could not use a little bit of fat lipolysis? And so that's a wonderful area as well. That does take a while as well. And I'm not really certain about what the true mechanism of action of that aspect is, but it's probably not so much that it's breaking down fat cells, is that it's not making more fat cells. And so when we do need a little extra surge of energy and glucose breakdown, the fat breaks down, but we're not adding back to it. So that's probably more about where that occurs. Another area that is somewhat impactful in weight loss is that these peptides tell the liver to like, go ahead, like, can you please stop making glucose? Like, we already have enough, we're good. And so the liver has a responsibility to do this. This is part of its job. And it does this in a normal working system. It does this typically at night where we go to sleep and our blood glucose levels at whatever level it is, and it just slowly declines. We're not eating or drinking, it just kind of slowly declines. And then kind of in the early morning hours, our glucose level eventually drops enough that our liver says, oh, hey, let's go ahead and release some more glucose. And so it makes this glucose. And so then we see a slight increase in our glucose levels. And in a normal system, it's not a dramatic increase. We wake up with a low morning glucose, right? But not too low. Where in some systems that are dysfunctional, we can actually see kind of a pretty big increase. And so that's more of a diabetic problem where we see these high fasting glucose levels. But all in all, these shots are saying, you know what, liver, go ahead and hang out. You don't need to work so hard. We really actually don't need more glucose. And you're probably reading our system because our system's all dysfunctional and you're reading the wrong numbers and therefore you're producing based off bad data. The other area that it works is steatosis. So steatosis of the liver, fatty liver, is just basically fat deposits in the liver, and it can cause some scarring, and it can be run anywhere from mild to severe and liver failure and everything. So fortunately, most people kind of stay mild. I don't see a whole lot of people progress, but I have seen pretty bad fatty liver situations. And so it reduces those fat deposits, right? That lipolysis. So it can improve your liver function, which is wonderful. And then another area that's unrelated to weight loss, but very exciting, is increased cardiac protection. And the evidence is so strong with this, it's actually an FDA approved aspect of these injections. And that's very new. I'm recording this video in late 2024, and this is a very new aspect. So we're not really sure how that's going to play out fully in the population, but it was recently approved for that. And then another area that is not on this diagram just yet is that there may be some evidence that we're going to see in the future of brain protection. So if you're doing these injections for weight loss, that's wonderful. And I'm hoping you're one of these guys over here in the top left corner that you just start losing weight right away. And it's very exciting. And then meanwhile, we kind of see some of these other things occur. And over time, you lose weight, you reach your goals, and you're able to stop the injections or go into a maintenance phase kind of thing, or stop and start as if weight creeps back on. And then over time, hopefully you can just maintain your weight without any injections. That would be great. But there's some of these other wonderful aspects as well. So thanks for listening. And we look forward to hearing from you if this is something that you want to proceed with. Thanks.